Honorable Member for Microsoft Central.
Thank you, Mr. Speaker. Sir, to rise at this point in the debate, and I thank the honourable member who spoke before me for helping to bring back into focus the subject of this resolution, because we're one to tune in only at the point of the intervention of the Leader of the Opposition. One would be very confused about what we were discussing here today. But sir, I thank you for the opportunity to speak to these two very important resolutions on these special loans. The young people who were with us this morning acknowledging the 16 days of activism to end gender-based violence shared a pin with us that says, "I pledge to stand up for what is right, even when it is difficult." And I think that the fact that that was pinned against his breast and perhaps not clear for him to see meant that the Honourable Leader of the Opposition perhaps did not receive that message before he got to his feet. Sir, I feel very strongly that Barbados has worked hard to evolve a mature democracy. And I regret that the example of that democracy that those young people will have been forced to witness by the time they took leave from us included the kinds of what I would call uncharitable and undignified references to the work of the government of Barbados that we heard today. I believe that all Barbadians want to hear and want to see transparently what government is doing in its name, the work that government is doing on its behalf. That is the reason that this government is at pains to have reformed the method by which we bring financial information to the public, to have, as part of our estimates conversation, a full questioning by this chamber of what has been expended and what the government proposes to spend. The Honourable Member for Christchurch East Central, who led the debate on these resolutions, made reference to the exact part of the estimates document that will show to Barbados and all who are interested exactly what that expenditure is, what it was used for, where expenditures were not made, where the targets for capital work spending were not met. Because these are things with which we have to come to terms as well. We have to be able to understand and balance what are the inputs that are going to allow us to meet our targets, to be able to deliver and provision for the people of this country, and where do we need to supplement those as necessary. The Honourable Member for Christchurch East Central also took us through some explanation of the difference between the investment loan that we are hearing about with respect to the expansion of the Queen Elizabeth Hospital and the policy-based loan that forms the other part of this cognate debate. Sir, every week or month or every other day, depending on how you prefer or how you are able to provision your own home, you may go to the supermarket or you may go to the corner shop and you may buy some things to cook, you may buy some things to wash, to clean, and so on. But in order for you to be able to put together a meal for yourself and your family, there are some other things that you need. You need a spoon to be able to stir. You need a pot to be able to cook the food in. You need some inputs so that in addition to the day-to-day things that you have to buy, you also need to have some tools. You also need to have the items with which to be able to put these meals together. So the running of a country, the running of a government, and I hope that the leader of the opposition is learning this lesson, because he has not really interacted much with governance of a country. He seems to believe that you just stand up and yell, and this is how governance happens. It takes a certain maturity, it takes a certain patience and understanding to be able to run a government. And so there are major investments that a government will make, but then there are also the operational things. There are also the wages and salaries and investments in people's development, in the jobs that they do and in the roles that they play. There are the operational things that government has to always make sure it can deliver. And then there are the major investments that help people realize the fullness of their well-being. And so government, in its financial planning, has to be able to provision all of those things in different ways. Sir, I would never suggest to a person that they take everything they've been able to save and use that cash to build a house or buy a house. There are some people who may choose to do it, but the truth is that the point of borrowing is to be able to finance long-term investment from which you are going to be able to continue to see the returns year after year. So when you service that debt, when you pay that interest, what you're essentially paying for is the utility of that investment year after year after year. That way, you hold on to your liquidity, your cash, for the kinds of things for which you need cash. That is a simple difference. That is a simple reason that we choose to finance major investments. That we don't look to pull in all of the revenue and all of the cash and build a geriatric hospital or expand the QEH. Those are long-term investments. And we know that the wisdom of public finance is that governments or even corporates need to be able to prioritize spending that enhances productivity and that provides a pathway of long-term growth. The experts will advise you to borrow for that reason. But not only that, we see countries, sir, Barbados is today at what? 99% debt to GDP, about. Sir, there are countries, developed countries, that are way beyond that. The US, I believe, is over 100%. There are other countries, sir, that have a higher debt to GDP ratio than Barbados. But their debt is considered sustainable. Why? The test of whether a country's debt is sustainable, in other words, whether or not it will become a burden to generations today and in the future, is whether a government can easily service that debt without sacrificing investments in long-term growth and productivity. It's really that simple. And to the extent that this Barbados Labour Party government has done what a previous DLP government could not manage to do, sir, a former Minister of Finance used to come in here and throw his hands in the air and ask, what would you have me do? And I could never understand it. Because it seems to me that an administration or a government that has laid out a clear pathway to be able to pay its bills, not only to the international community, but also domestically in circumstances where the government of Barbados was made shame right here at home by the fact that we could not pay service providers. And if we were not paying service providers, where is the growth coming from that the Honourable Leader of the Opposition is looking for or talking about? It is only when we are able to put that money back in people's pockets, it is only when we are able to pay people on time and make sure that they can continue to invest in their businesses, that we see the kind of growth that he is looking for. But sir, I spent many years, maybe not many, but some years alongside the member for Christchurch East Central, working on what that debt portfolio composition should look like and seeking to explain it bit by bit and piece by piece to the people of Barbados. And we will continue, this government will continue to do that. But sir, I also want to get to the substance of the investment loan that is here. The 316 million Barbados dollars that is to be used for the purpose of the expansion of the Queen Elizabeth Hospital. I grew up, sir, and as I make reference to my childhood, please allow me to express my condolences to the family, friends, and colleagues of the now late Maurice Norville. I called him Uncle Maurice growing up because he is the father of my childhood best friend. And I know that this country will miss the energy and professionalism of his broadcasting and really the life that he brought to us all on the airwaves and beyond. But, sir, I grew up going to what we call Lady Mead Polyclinic. It's Sir Winston Scott now. And that was, for me and my family, the core of our access to healthcare. At that polyclinic, we got dental care, eye care. My mother was able to access antenatal services. Essentially, the polyclinic was the first and, hopefully, because of QEH's tertiary treatment, hopefully really the first and only point of healthcare access for many families. And I say that because as we invest in the Queen Elizabeth Hospital, and I acknowledge the information shared with us by the Honourable Member for St. Michael North about the concurrent investments in polyclinics and others, I want us to always remember that it is the care delivered at that level, the care delivered at the level of the polyclinic, at the primary healthcare level, where we are teaching people about nutrition, where we are making sure that people understand how to care for their teeth, how to care for their eyes, how to care for their toenails and extremities if they may already be considered at risk for certain kinds of illnesses. But it is at that point where the interventions that you make are more of a counseling and guiding nature and preventative nature. And I cannot emphasize enough that the more we spend there, and with other more creative ways of encouraging people to take care of their health, the less we will have to spend on the kinds of interventions that are itemized here in this resolution. These investments are necessary. No. They're necessary now because, regrettably, we have reached a place in our NCD status where we have now to try and manage a heavy burden of NCD care. If we invest more in primary care, it means that we do not have to make such tremendous investments later on in the healthcare system. But I mentioned Sir Winston Scott Polyclinic, sir, because I am mindful of the relationship, not just between primary and tertiary healthcare, but the relationship between the institutions that together keep Barbadians well. And over the weekend, I happened to be on the road just opposite the QEH, which is a part of St. Michael's South Central. And talking to the folks out there, I was also reminded of many conversations we had about how the expansion, any expansion of the Queen Elizabeth Hospital on its current site or over to the Enmore site on the other side of the road would and will have to include the community of which it is a part.
Bannister Land, honorable member.
Thank you, sir. Delamere Land, Bannister Land, Campaign Land.
Yes.
Sir, you know, institutions matter in more than their functional capacity. Institutions matter in more than their functional capacity. When the Central Bank of Barbados, the Tom Adams Financial Center, was being constructed, notwithstanding all of the doubt and all of the debate that surrounded it, it emerged as a beacon of economic development and growth of this country. At the time, it was the tallest building in town that said to the people and communities around it, this is who we are. That said to the people immediately in its vicinity, the communities, the young people, the people living and working and running about around there, this is a part of you, and this is who you can be. And this economic development is for you and with you. That is what that building meant to me. And so equally, the Queen Elizabeth Hospital means something beyond its functional capacity, which is important, to the communities that it faces. Many of the people in those communities ideate careers and jobs and work around that institution. They see it as an emblem of what they can aspire to and do. And so people will tell you, people living right in that community will say, I want to be a radiographer. There's a family, sir, that, you know, as MPs, we love all our families. And it is possible that each family or different families represent different things to some of us. There's a family that's right across the road there. 2 granddaughters. One of them, when we met, was studying to be a doctor, the other training to be a nurse. You know the family, sir. You know most of them out there.
That is correct.
And I would visit them and see how they were striving in the community that they were born in, and see how they looked at the hospital as the way that they would succeed. The institution, the beacon that would take them to their success. Similarly, sir, when we came to service as a government in 2018, and I had the privilege of working with the Ministry of Economic Affairs and Investment. We worked on the Constitution River upgrade, Halls Road. And we said at that time that these kinds of investments in infrastructure cannot happen without concurrent investments in how people live and what this is to mean for the people living there. Sir, I raise all of these things because I still feel very strongly that while the people of the communities around the hospital, who also feel a sense of safety, that they actually live right next door, and were something to happen, they have immediate access to care. That there is a sense of security in that. But they also feel very much that they must be and want to be a part of the redevelopment of that area, a part of the redevelopment of what that area offers to Barbados. Sir, when I was speaking to the young people in Bannisterland on over the weekend, a big part of the conversation was about how they felt the hospital could be improved and how they felt they could contribute to that. Sir, perhaps just before COVID, I also had the opportunity to go with the then Minister of, well, both Ministers of Youth, Sports and Community Empowerment, the then Minister and the subsequent Minister, to look at the development of the area immediately opposite the hospital that people now use for parking. Sir, in those discussions, in which we included people from the community, we heard lots of stories about how that area used to be used, how much cricket used to play, how many teams were born right in that patch, right there. And there was a sense of loss. There is a sense of loss. That area that has meant so much to this community is not now enjoying the redevelopment that others are enjoying. So I take it from this resolution and from the plans of which the member for St. Michael North is so excited, as he rightly is, we all are. I would like the people of St. Michael South Central to be equally excited. I take it that the improvements that are contemplated for that area are meant to include the people, the community infrastructure, and the livelihoods of those people in those communities. So we said, and I was Minister for Investment when we said it, I said it with my whole chest, that we will not be a government that presides over the expansion of private or public infrastructure that does not bring people along. We were talking on that occasion about tourism infrastructure, about hotels, like the ones going up now in Bay Street and the ones going up on the West Coast. We said, and we put the instruments in place, because I was the one who was able to do it, along with others working in the ministry. We said that investors must have a facility to be able to invest in the common infrastructure, the community infrastructure, the drainage, the sidewalks, the culverts, the engagement of young people, the lights on playing fields, that investors, developers must have a facility to invest in the people. that are in those communities. And I say these things because I expect that over the 48 months or before, when we start to see the expansion plans, that those include, you know, one of the things the guy said to me on Saturday, sir, was, you know that right now, if you work at the hospital, there's nowhere for you to get healthy food to eat. And I mean, I don't want to tell people business, but these are the facts. That people are looking on and saying, this is the way in which we think that this institution of ours should function, and this is how we think that we can contribute. There are income earning opportunities. Real income earning, I mean real business creation. Because I think that sometimes we believe that we give a man a blade to sell on a spot, and that is creating intergenerational wealth for our families. I am saying don't give a man a blade to sell on a spot with the appropriate licenses and so on. But I'm also saying let us build businesses that last for the communities around these institutions. Let us create a pathway for people in those communities to be able to offer services themselves. The QEH must be the largest employer in the public service. And so that group of employees as a market for people selling services is a significant market. Those people are ready to be a part of this expansion. The area itself, sir, is ripe to benefit from infrastructure development. Sir, this is tenantry land. This is
Norville tenantry land, honorable member.
Yes, correct, sir. This is, sir, the legacy of a Barbados Labour Party that said to Barbadians in landmark legislation that we are going to give you the right of ownership of this property that they told you you could only occupy until we're ready. You could hold on there and you could work there on conditions that we give you, but nothing here don't belong to you. And we said no. And the Tenantry Freehold Purchase Act shifted that reality for many families, and we continue so to do. And so that the transfer of those lots to those people, so that they can have that. The upgrading, sir, I'm happy if we start with the upgrading of the area that people are parking on now. And I'm waiting for the member for St. Michael North to look across at me and start to nod and say, yes, that's what we plan to do. But he like here and looking out here. Sir, these are interventions that signal intent. These are the ways in which you say to a community, we are not just building wings and wards and units which are critical. I don't think there's anybody in here who will deny that these investments are important. But sir, I would not feel comfortable seeing and being involved in a development of this nature in this area, in town, just like Central Bank was in town and started to mean so much for people. that does not simultaneously upgrade the living conditions of people in that community. Sir, the fact that the test of good debt is the extent to which it enhances productivity and provides a pathway for people to be involved in the long-term growth of the country means that the test of this loan for this expansion is whether it is able to do that for the people of Delamere land and Bannister land and Campaign land and Bridgetown and all of the surrounding areas. Let us have the same investment in people's lives and livelihoods that we are making in people's health care. They are part of the same equation. If people are able to earn and recreate and feel proud of where they are from, they are more likely to be motivated to take care of themselves and their health. And so, sir, I support these resolutions, and I look forward to seeing how they help develop the communities around them. I'm obliged to you.